Initially, what are your thoughts on this deal in principle, as it has to be ratified, between the Quebec government and the FMOQ?
Yeah, I think it's a good start. We don't want to put in coercive measures. We want to encourage family physicians to take on more patients and to be available, especially in the short term, for emergencies, so that people don't have to jam up the emergency rooms. And basically, their idea over the next year is to have accessibility to a family physician over a period of between 1 to 3 days, so that people can have their emergencies taken care of. If it's somebody who needs a blood sugar medication renewed or tested, someone who's not feeling well but not a real emergency can be access a family doctor. It doesn't, from what I understand, doesn't guarantee you're going to have a family physician, but you'll have access to a family physician. So it takes care of one of the problems of immediate access to avoid people going to the emergency room.
And for people who already do have family doctors, just based on your experience, what you've seen, how long have you seen people typically wait, for an appointment to get a prescription or just for a checkup, things like this?
Yeah. Well, we have, from what you read in the papers, you get the impression that there aren't a lots of slots available and that people um, sometimes have to wait a long time. I've always tried to encourage in my practice my nurse to deal, because she is a nurse. She can take care of lots of the questions uh, that if it's a renewal, she can get right away, get the prescriptions, get them to me. If I need to make do an acute treatment intervention, that we can do it in a timely manner. I'm very blessed that I have a nurse who can help me like that, but lots of offices don't have that unless they're a group of physicians. So I think we have, as physicians, need to reorganize our schedules to provide rapid access for patients. If you have a bronchial infection, you can't wait 2 weeks or 3 months to have that dealt with. It needs to be dealt with immediately, or any acute medical problem needs to be dealt with immediately.
And when we spoke yesterday, you mentioned a little bit, how this is a start, but more issues. There kind of needs to be more long-term solutions, such as hiring of more nurses. Is this something you could speak about a little bit, expand on a bit?
Yeah, there is a shortage of family physicians across Quebec. At least a million, um, at least a million patients don't have a family doctor and would benefit from having a family doctor. In fact, studies have shown that when you have a family doctor, it was in 2019 study that you decrease mortality for every 10 additional physicians. It had a significant, about a month and a half overall increased survival. And even if you compare the number of physicians we have in Quebec, family physicians, compared to the rest of Canada, there's a shortage of about 17 per 100,000 in comparison. So definitely a shortage here in Quebec. Also, we have a problem with the lack of filling the family residency positions in Quebec. This past year, it was about 73 residency positions, and over the last 10 years, around 467 residency positions were missing. Which, if you give about 1,000 patients per physician, family physician, that's close to 500,000 people could have been taken care of if we had filled all the positions. One of the problems is that it's less attractive for people going into family medicine. One of the reasons, there's a salary disparity of about 20%. And that there's for sure, if specialists gaining more money, then that's going to create a deficit. The other thing we also need to do is we need to train more family physicians, have more positions in the faculties of medicine. We also have a shortage of nurses, which across the province is creating a lack of access to care in the hospitals. For example, knee and hip surgeries, you have between 8 to 9 month delays. So even though people will have access to the family physician, they often can't get the care that they need. I have one patient, in fact, who's been waiting. He's a very active person. He's in his 60s and can't work because he's waiting for surgery for his hip, and he's going to have to wait at least 6 months.
That's quite unfortunate to hear, but I
Yeah,
can't say I'm too surprised.
yeah.
Would you say that you know, years, even decades of budget cuts to the healthcare system, do you think that it's affected these delays in accessing a family doctor in any way?
Yeah, absolutely. The government has been consistently, um, reducing investments. They've been increasing investments in healthcare, but not keeping up to the demand. And I think we saw this. The crisis really hit us hard during the COVID pandemic in the last 2 years. We were short on staffing. They even talked about a triage system, reducing, preventing access for people who need critical care medicine, who need to get in the ICU, based on their ability to survive. Really, the healthcare system should be built on those who need healthcare the most should get it. The sickest should have the greatest access, and not the reverse. They're in fact building a system where if you're more likely to survive, you'll get cared in the ICU. If you know we're just not going to let you in, and this is wrong. And it hasn't been a significant priority. Every government comes in, says we're going to improve things, but they don't really put because it takes money. It takes money to train doctors, train nurses, respiratory therapists. The provincial governments have been asking the federal government, for example, to increase their contribution to the healthcare, and the federal government has has had a deaf ear to the demands of the provinces. When Medicare first came into existence in the 80s, the federal government would give 50 cents for every dollar of Medicare dollar spent. Now they give somewhere in the order of around 22 cents. And the provincial governments are asking for 35 cents. It's not a big demand, but it'll make a big difference in terms of investing in healthcare. Increasing nursing schools, sizes, respiratory therapists. For example, at the hospital where I work, and I preside as the council president, we've had to close our ICU for the lack of respiratory therapists, and we have to transfer people downtown, which even causes even greater overflow downtown. So it's like a game of Chinese checkers. You're just constantly moving. You're moving the chips from here to there, but not fixing the system. It really needs to be. You need to have. You need to have access. To have access, you have to build capacity. We haven't built the capacity, and we need to look long term. The arrangement the government's making with the family doctors is a good thing in the short term, but it's not going to resolve the long term problems that we have. We need long term solutions, and I think the mindset has to change. Healthcare has to be looked at as an investment and not as an expenditure, because yes, you're taking care of people. You get them back into the, if they're younger and they're active, you get them back into the workforce. Those who are older, they're still important members of society, because they have families, they have, extended families, and every person and every life is valuable. And I think that's the change in the mindset we have. The government spends lots of time trying to pass legislation, and even mentioned it recently. We got to get the medical aid in dying expanded for other categories. They've already expanded to people who are disabled. The federal government wants to expand it to those with mental health issues. It's the wrong approach. We should be investing, making healthcare better, more available, so that people aren't going to look to have their life ended. A woman I read recently in Toronto asked medical aid in dying because of chemical sensitivities and not being able to get affordable housing. A 31-year-old woman. This is not the approach we have. We have to value every life, provide the care for everybody that we can. Can we do it? Yes. Because if we don't do it, we're just going to continue to go in a downward spiral in terms of healthcare services, and we need to value people. Every life is valuable.
Yeah, I actually did see that case. It's really unfortunate. Yeah, it's very scary. I guess I have two more questions for you. Just one thing I want to ask that you brought up before, in regards to emergency rooms being crowded. So would you say that, especially during the pandemic, but before the pandemic, has lack of access to family doctors resulted in overcrowding in emergency rooms?
I think the overcrowding emergency rooms really has to do with um, there's a lots of for example, lack of access to beds in the hospital, so that people stay in the emergency room. Uh, People staying in the hospital, there's no when they should be in another facility, either a rehab center or a nursing home, or return back home with adequate home care services. So the whole system jams up. Um, and that I bring up it brings up another point. Family doctors don't only work in terms of just outpatient medicine; they also work in emergency rooms, ICUs. Um, there's a whole the whole system depends on everybody. Everybody's a key player, and the backup, I think, is just, for example, just lack of capacity everywhere, lack of doctors, lack of nurses, because they can open up more beds if they have more nurses. They can have more physicians working in the emergency room, triaging people and with nurses caring for them if there were more doctors. Um, the other problem is that even in the city of Montreal, the government reduces the number of positions that they allow. They're called PREMS in the area of Montreal, and I think this past year there were 30. There was a reduction of 30 or 30 not granted. So that's another 30,000. If you give 1,000 patients per doctor, which is a very reasonable number. Some do more, some do less, but say on the average of 1,000 patients per doctor. There's less access in the area of Montreal for family doctors because the government doesn't give postings, so people can't. Without postings, they can't bill. They can't get their billing number. So all these things contribute. So we really need to have a short term and a long term view. Um, there are lots of young people who want to go into medicine, nursing, and they don't get positions because there's not enough positions in the faculties of medicine, nursing, respiratory. We need to also provide enough financial incentives to make it interesting, so people don't want to go into business, that they want to go into healthcare. All these things contribute. And then we also got to look at that in terms of the next few years. There was a study recently done which showed that half the doctors, family doctors, felt very stressed and burned out, and about that same proportion are thinking of reducing their hours. So we have to um, try to encourage doctors not to give up, not to retire. Um, or cut back on their production, workload, and not to and provide the just the general supports. I mean, there's financial incentives. Yes, that's important, but it's not the only. I just think the valuing of people. I think even for the population who's feeling stressed, I find that there's an increased stress by patients, and some of them are just very angry. And thankfully, I have a nurse who can talk to them and try to reduce it with all the lockdowns and the curfews um, and mask mandates and vaccine mandates. All these things have put a lot of stress on people. That also I think has to look at. The government needs to look at, well, were their policies the best? Were they necessary? Were they helpful? And what those things that weren't helpful, like studies have shown that curfews and lockdowns weren't beneficial, did not make a significant reduction in COVID transmission or mortality. They have to be looked at and changed. We don't want to continue putting stress on everybody. The government needs to be a little more uh, open and transparent in everything they do. A recent study by the coroner looked at the deaths in nursing homes, and they made a whole series of recommendations. Saying the government has to be more responsive. The government has to take their responsibilities too, in terms of improving healthcare, improving home care. Um, and I think that's a very important step. That there needs to be a debate of how we can improve healthcare, and the government needs to look at those issues and try to be responsive.
Thank you so much. And then I just had one last thing I wanted to ask. You mentioned this yesterday too, but how the pandemic has exposed the strain within the healthcare system. I know you've already kind of delved into that, but is there anything more you'd want to say about this?
Yeah, I think that we can't blame the pandemic for causing the problems in our healthcare system, or because there's always going to be, winter flus. There's going to be other strains that will occur. We have a population that's aging, so there's going to be bigger demand on our healthcare system. We need to build capacity. We need to have just general capacity at all levels. Family doctors, we've talked about that. Nursing, and home care services. All these things, they all work together in a puzzle, and we can't remove one piece. And if we do remove one piece, then we can't solve the whole puzzle. So we got to look at it as an investment. Government needs to look at it short term and long term. Um, Capacity is important. Capacity means people, means investing in their education, um, and providing salaries and listening to them, listening to the nurses and saying, listen, what can we do to make your life better? Doctors, what can we do to help and make your life better? I think the government trying to negotiate with the doctors is a good first step, rather than passing bills and mandating this and mandating that, because all that's going to do is cause more stress and encourage more doctors to um, um, go work early retirement, or go into the private system. We need a strong, robust public system so that everyone can have access.
Thank you so much for your time. Is there anything that I didn't ask that
No,
you want to share or
I
mention?
think you've got, I think you've got, I think you've covered pretty much everything. And yeah, family doctors are important. They're, when you have them there, they can be there to um, direct you, to tell you if it's an emergency, it's not an emergency, get you access to specialist care, and provide a listening ear, do screening tests, and I think that's important, and that's what people want, someone that they can come to and coach them in terms of their health care.